Hello everyone, welcome back to my YouTube channel Success Pharma. In this video, we will discuss about dose response curve and therapeutic index. जैसा कि आपने लास्ट वीडियो में एंजाइम इनहिबिशंस एंड ड्रग रिलेटेड टू एंजाइम इनहिबिशंस देखी थी. We were also discussed some specific examples of drugs. In case of competitive reversible type of inhibition, we were discussed physostigmine used as acetylcholinesterase inhibitor, sulfonamide used as folate synthetase inhibitor, carbidopa, methyl dopa used as dopa decarboxylate inhibitor, maclobimide used as MAO-A inhibitor, captopril used as ACE inhibitor, allopurinol used as xanthine oxidase inhibitor, letrozole used as aromatase inhibitor, finasteride used as 5-alpha reductase inhibitor. We were also discussed some examples like methotrexate and organophosphate in case of irreversible type of inhibitions. So let's start the video. First, you have to know what is dose. Dose, it is the amount of drug administered to produce a certain degree of response in a patient. Means वो अमाउंट ड्रग का जो किसी भी पेशेंट में कुछ रिस्पॉन्स प्रोड्यूस करेगा, दैट इज नोन एज डोज. Dose response relationship has two components. First one is dose plasma concentration relationship and second one is the plasma concentration response relationship. Second one is the response. What is response? The change in the activity of cell or tissue produced by the selected dose of drug is called as response. Response क्या होगा? जब भी किसी डोज पर्टिकुलर डोज ऑफ ड्रग पर हमारी बॉडी कुछ रिस्पॉन्स प्रोड्यूस करेगी. एक्टिविटी पर्टिकुलरली द सेल और टिश्यू विच प्रोड्यूस अ सिलेक्टेड डोज ऑफ ड्रग and produce some specific response that is known as response. Dose response curve. This topic is very much important for GPAT and NIPER exam. There is a direct relationship between the dose intensity of response of the curve, that is intensity of response increases with the increase in dose. Means जब आप किसी ड्रग का डोज बढ़ाएंगे तो उसका रिस्पॉन्स भी ऑटोमेटिकली इंक्रीज होगा. A typical curve showing the dose response relationship is called dose response curve or DRC. DRC simply एक कर्व होता है जिसमें ग्राफ होता है डोज, लॉग डोज और रिस्पॉन्स के बीच में. The graph plotted between the log dose or response, the curve becomes sigmoid or the shape of the curve is about sigmoid shape or S-shaped curve is plotted between the log dose or response, that is known as DRC. Now, this is a DRC curve or dose response curve. So here the graph is plotted between dose or response. So the red line indicating the graph between the dose and response and the blue line indicating log dose versus response curve. What is the importance of DRC in pharmacology? So the DRC of drug is very useful to predict potency, efficacy and safety of drug. So these three parameters are most important for any type of drug, that is potency, efficacy and safety of that drug. So first one is the potency. The position of DRC on the x-axis is an index of drug potency. मीन्स जो एक्स एक्सिस पे वैल्यू रहेगी वो उसकी ड्रग की पोटेंसी होगी. मीन्स एक्स एक्सिस पे जो भी वैल्यूज होंगी फ्रॉम 0, 10, 20, 40, दैट इज नोन एज पोटेंसी ऑफ दैट ड्रग. अ DRC पोजिशन्ड rightward indicating lower potency. Drug A is more potent than drug B since it produced intensity of response as drug B is much smaller doses. Means जब rightward होगा DRC means the drug have lower potency, so the graph is rightward, and when the drug have more potency, so the DRC is shifted toward the left side. Log dose versus response curve for the potency and safety of drug. So here this diagram represents the 4 drugs producing the same effect or same qualitative effect. So here 4 drug means A, B, C and D. So first we are talking about the efficacy of drug. Efficacy means what is the response of that drug. Now DRC. So what is the importance of DRC? DRC is used to determine or compare the dose of 2 agonist drug at which they produce half maximum response. तो DRC का यूज किसी भी 2 टाइप्स की एगोनिस्ट ड्रग की कंपैरिजन स्टडी में किया जाता है. फॉर एग्जाम्पल 10 mg of morphine is equivalent to 100 mg of pethidine to produce analgesia. Pethidine and morphine are the opioid drugs. They are used as analgesic or to relieve pain. So morphine is more potent or it is 10 times more potent than pethidine because the amount of morphine is 10 mg and amount of pethidine is 100 mg to produce the same effect. सिंपली ऐसे समझ सकते हैं जो मॉर्फिन का अमाउंट है वो कम यूज हो रहा है फॉर द प्रोडक्शन ऑफ सेम टाइप ऑफ इफेक्ट, बट पैथिडीन का अमाउंट ज्यादा यूज हो रहा है तो यहाँ पर मॉर्फिन ज्यादा पोटेंट कहलाएगा. आई होप आप पोटेंसी के बारे में समझ चुके होंगे. पोटेंसी मीन्स एनी ड्रग यूज्ड इन स्मॉलर अमाउंट टू प्रोड्यूस द मैक्सिमम थेरापेटिक इफेक्ट दैट इज नोन एज पोटेंट ड्रग्स. मीन्स कोई भी ड्रग जो कम अमाउंट में मैक्सिमम थेरापेटिक इफेक्ट प्रोड्यूस करेगी उस ड्रग को हम पोटेंट ड्रग बोलेंगे. सेकेंड वन इज द इफिकेसी. द अपर लिमिट ऑफ DRC इज द इंडेक्स ऑफ ड्रग इफिकेसी एंड refers to the maximum response that can be produced by the drug. जो maximum response कोई भी drug produce करेगी उसे efficacy बोलेंगे. For example, morphine produce a degree of analgesia not obtained any dose of aspirin. Aspirin is also an analgesic drug, but जो morphine जितना effect produce करती है वो किसी भी dose of aspirin में produce नहीं होता. Means morphine का 10 mg मैक्सिमम एनाल्जेसिक इफेक्ट प्रोड्यूस कर सकता है बट एस्प्रिन का कोई भी डोज सेम इफेक्ट प्रोड्यूस नहीं कर सकता है. मॉर्फिन इज मोर इफिकेशियस देन एस्प्रिन. मॉर्फिन इज मोर इफिकेशियस बिकॉज इट प्रोड्यूस मैक्सिमम थेरापेटिक इफेक्ट और हायर एनाल्जेसिक इफेक्ट देन दैट ऑफ एस्प्रिन. डिपेंडिंग अपॉन द टाइप ऑफ ड्रग बोथ हायर and lower efficacious drug is clinically preferred. So based on the patient condition, both type of drugs are equally efficacious or equally preferred. This is the most important parameter for any type of drug, that is drug safety. So the safety means the slope of the upper part of the curve is useful in measuring the relative safety of drug. सेफ्टी मीन्स स्लोप. तो किसी भी ड्रग का जो DRC होगा उसका स्लोप उसकी सेफ्टी डिसाइड करेगा. फॉर एग्जाम्पल मोस्ट ऑफ द CNS डिप्रेसेंट ड्रग हैव स्टीपर स्लोप विच इंडिकेट अ नैरो मार्जिन ऑफ सेफ्टी बिटवीन द डोज दैट प्रोड्यूस सेडेशन एंड द डोज दैट प्रोड्यूस कोमा. मीन्स जो CNS डिप्रेसेंट टाइप की ड्रग होंगी उसमें स्टीपर स्लोप होता है विच इंडिकेट नैरो मार्जिन ऑफ सेफ्टी. So the same amount of drug or same dose produce sedation or on smaller increase in dose may produce coma or severe health problems. So these type of drugs are known as of steeper slope of DRC or having narrow margin of safety. Second one is the drug with flatter slope of curve that produce little increase in response over a wide dose range and has greater margin of safety. Greater margin of safety means flatter slope होगा और जो ड्रग जिनमें स्मॉलर इंक्रीज ऑफ डोज का कोई ज़्यादा इफेक्ट नहीं पड़ेगा. मीन्स थोड़ा डोज इंक्रीज करने पर भी वो सेम इफेक्ट प्रोड्यूस करेगी. सो दे आर नोन एज ऑफ वाइड सेफ्टी मार्जिन ड्रग्स. This figure represents the DRC of therapeutic effect and adverse effect of same drug. Means same drug both type के effects produce करेगी, therapeutic effect as well as adverse effect. It depend on the MEC and MSC. So what is the MEC? MEC means the minimum therapeutic effect or it is known as minimum effective concentrations. So this, what is therapeutic index? In term of DRC, we are defined as the gap between the therapeutic effect DRC and the adverse effect DRC is defined as the therapeutic index of that drug. The therapeutic index gives a measure of margin of safety of that drug. Simply यही क्वेश्चन आता है, what is the safety margin of drug? So answer is therapeutic index. Therapeutic index को किसी भी ड्रग का सेफ्टी मार्जिन बोलते हैं. Second one is the therapeutic index is equal to the median lethal dose to median effective dose. Median effective dose is the dose that produce the specified effect in 50% individuals, and median lethal dose is the dose of drug lethal to 50% of individuals. So median effective dose is known as ED50 and median lethal dose is known as LD50. So LD50 upon ED50 is equal to TI or therapeutic index. Thank you all for watching my videos. For more like, share and subscribe my channel. At last, सूरज सा तेज नहीं मुझ में, दीपक सा जलता देखोगे. सूरज सा तेज नहीं मुझ में, दीपक सा जलता देखोगे. अपनी हद रोशन करने से तुम मुझको कब तक रोकोगे, तुम मुझको कब तक रोकोगे. थैंक यू सो मच.